Hi, I'm Dr. N. Edward Dourron at Pathways Fertility in Atlanta, Georgia. And I wanted to talk a little bit about diminished ovarian reserve. It's a term that is often synonymous with patients that are over 40, but I've had quite a few patients over my 30-year career that are actually under 35 that have diminished ovarian reserve. And sometimes that can be attributed to severe endometriosis and multiple surgeries that end up removing a lot of ovarian tissue and eggs with that. Sometimes it's a genetic predisposition to premature menopause. But the bottom line is that if you have patients, especially if they're younger, that have diminished ovarian reserve, the important concept there is that egg quantity is related to these markers like AMH or the follicle stimulating hormone FSH. So when you look at these markers of diminished ovarian reserve, they basically let us know that you're not going to produce a lot of eggs if you're given a conventional or standard stimulation protocol. For patients that have diminished ovarian reserve, it says nothing about their egg quality. The egg quality is really just related to and correlates with the age of the patient. So if you have a 32-year-old patient that has diminished ovarian reserve and therefore is not going to make 20 eggs when you give her lots of gonadotropins, it doesn't matter that you can give her a minimal stimulation or natural cycle approach where she produces 4 to 6 eggs, because that's all she should need in order to have a healthy baby. So that some patients with diminished ovarian reserve and have a very low AMH level or an elevated FSH level, regardless of their age, are told that you really have no choice other than donor egg IVF. The important thing is that you always have to view things as your chronologic age and your ovarian age. So ovarian age is correlated to quantity of eggs. Chronologic age is correlated to quality of eggs and their subsequent embryos that develop. So that in patients that are under 35 and find themselves in a position of being told they have diminished ovarian reserve, hope should not be lost, because at that point we know that age is on their side, and if we can just get them to grow 2 to 4 eggs, we should have the tools that we need to help them have a baby, even though they're not producing dozens of eggs like their counterparts would that don't have diminished ovarian reserve. I hope this has been helpful. Thank you.